Hi, everybody. So yes, I want to talk to you about Concenter and about diabetes. I'll explain a little bit about the status of this disease and what we have done and where we are and what we're looking for. I know everybody's a little bit tired. I hope just a little bit, not too much. So let's start. So the problem, as you can see, is a very big problem all over the world. Currently, about 537 million people have diabetes. I'll talk about the difference between 1 and 2 in a second. And by 2045, the number is supposed to grow to about 783 million. So unbelievable numbers. In the States recently, it was published that about 50% of the population is either diabetic or pre-diabetic. That's not a mistake. 50% are either diabetic or pre-diabetic. Again, in the States, it's about 13% now that are diabetic and about 37% that are pre-diabetic. Of those that are pre-diabetic, by the way, about 25 to 30%, depends who you ask, are going to be diabetic. So imagine the numbers that we're talking about. In terms of global health expenditure, it's $1 trillion a year now on diabetes. And the most surprising thing that we can say about diabetes market is that there is no real treatment. I wrote no efficient treatment, but basically there's no real treatment against diabetes today. So on the bottom, on the left, it says type 2 diabetes about 90 to 95%, and type 1 diabetes about 5 to 10%. So we are focused on type 2 diabetes. Again, about 95% of the people with diabetes have type 2. The difference basically, I'm sure most of you know, but in just one word, the difference is that if you have type 1 diabetes, basically you don't produce insulin at all. With type 2 diabetes, it's a little bit different. You produce insulin, but something goes wrong along the way. We'll talk about it. We're not going to go into the many details on this slide, but in this area, in the Middle East and North Africa, diabetes is the worst all over the world. That's just the point of this one. In the UAE, by the way, we're talking about, in 2021, about 1 million people with diabetes, growing to 1.3 million in the next 25 years. So the numbers are very high. Again, something a little bit weird to think about it, but it's not really understood exactly what causes diabetes. So there's a link with overweight and obesity, increasing age, ethnicity, and family history, and of course predisposition to diabetes. But the important thing to remember is that the number of people suffering from diabetes is growing all over the world. The age groups, if before type 2 diabetes was a disease that affected elderly people, now it affects youth, young children, even 10, 12, 13 years old, already get type 2 diabetes. And again, no cure for sure, but even no real treatment. All the treatments today either treat the symptoms or the complications of the disease. That's it. Not the core problem, which we'll talk about in a minute. And usually, when you talk about treatment, you start out with one drug, usually metformin, which is the first line of defense against type 2 diabetes. Again, it doesn't do anything to treat type 2 diabetes. And then usually you move on to dual therapy, triple therapy, 1 drug, 2 drugs, 3 drugs, and then usually you move to a combination of pills and some injectables, including insulin. So that again proves that not only is there no cure, but the disease gets worse over time for everybody, and nothing really works to treat the disease. And our drug is called Zygozid 50. It's going to be, or is, an oral pill, and we believe it might even be a monotherapy for treating type 2 diabetes patients and also preventing type 2 diabetes for pre-diabetes patients. And again, remember what I mentioned in terms of numbers initially. Most of the people are pre-diabetic, and we want to save 25 to 30% of those as well from becoming diabetic. We won't go too much into this, but as you can see, in order to get type 2 diabetes, basically you need two things to happen. You need to have insulin resistance in your body. Basically, that means that the glucose from the blood does not enter the cells where it is needed. So you have too much sugar in the blood and too little sugar in the cells, and too much insulin is secreted in order to try to get that sugar from the bloodstream into the cells. So too much insulin, too much sugar in the bloodstream, not enough where it's supposed to be, and this gets worse over time. So insulin resistance gets worse over time. And it's true for the fat tissue, for liver, for muscle, for even the pancreas has some issues with that. And the other thing you need to have type 2 diabetes, insulin resistance, the second one is you need some problems with your insulin. It might be the secretion, it might be the packaging, it might be some form of something a little bit on the lines of the packaging and something on the secretion, but these two things have to come together. So basically your body produces insulin, but it's not doing its job. So it produces more insulin, eventually your pancreas starts getting tired, and insulin resistance continues to rise, and the pancreas gets even more tired, and that's when usually you move into what I explained earlier, the need to inject a little bit insulin in order to avoid getting your pancreas burned out altogether. Another thing that we think happens, what causes insulin resistance, again, that's something that not everybody 100% agrees with. So one of the things that causes insulin resistance is inflammation. Chronic systemic inflammation in all of your body. And inflammation is also caused by too much of this bad iron. Again, we're not going to go too much into that, but you know, sometimes we call this loosely bad iron that you have in your system, which causes inflammation, and this causes insulin resistance, and as I mentioned, causes eventually type 2 diabetes. So a little bit about our company. We started in 2015 by taking IP that was developed at the Hebrew University, Hadassah Medical Center in Jerusalem, Israel. And we built a team and we started working on taking this IP from the lab and bringing it to commercialization. Recently we conducted the first clinical trial after having a lot of preclinical trials on our drug. The clinical trial was conducted at the Sheba Medical Center. It's a medical center in Israel, now considered one of the top 10 medical centers in the world. We'll talk about the results in a minute. We also were awarded recently, again, it's kind of recently because 2 years of pandemic somehow kind of got lost in the middle, but we got the first place in the 17th World Congress on Insulin Resistance, Diabetes, and Cardiovascular Disease. I think that's the #1 conference in the world that talks about diabetes. And we were awarded first place from many companies and universities that submitted information, and our drug, Zygazid 50, was chosen as a very promising solution. We also got some other awards, and we raised money. In 2020, we raised money from a crowdfunding platform in Israel. So this pilot study that we did, historically, our drug was administered by subcutaneous injections in preclinical trials, and we wanted to continue with that route in the first clinical trial in order to avoid the complications of having an oral dose and what happens through the gastric tract, and not knowing what will happen to the drug in the system. So we started this first clinical trial with the hope of recruiting 10 diabetic patients, actually. It's not only a safety trial, it was actually a safety and efficacy trial. And we wanted to recruit 10 patients that would get our drug daily injection, subcutaneous